Next up, we have the Weldon Cooper Center, UVA.
Imagine that your son or your daughter or maybe your parent has gotten a new prescription for narcotics and you're kind of nervous about it, right? You've seen on the news that having a prescription for an opioid can lead to drug dependence, drug addiction, and even death due to a drug overdose. Well, the solution that we have proposed interrupts that progression from the prescription to some of these other negative sequelae through awareness, education, and support. And they do so through a patient-centered and family or friend advocacy program. And as a registered nurse for over 20 years, I know that the patient and family-centered approach is very critical to patient safety efforts. So the question we asked is, how do we promote relevant personalized education using existing data before opioid misuse, abuse, or addiction occurs? And what we came up with is something we call On-Track PMP, which utilizes existing prescription monitoring program data and use of a personal advocate to support patients through the safe use of prescription opioids. And in healthcare, an advocate is often a person, very often a family member or a friend, who helps the person who has an illness to navigate the healthcare system and helps them with their illness, which is why in this case we call it an advocate. So when the prescription is written, the patient is instructed for them to register themselves and their advocate for a PMP alert. The PMP system, using existing data and infrastructure, generates the alerts and also develops a personalized database that is only viewable to the patient and advocate. And then patient and advocates receive reminders and alerts, including patient education about warning signs and CDC recommendations, but also resources such as the direct phone number to their prescription, to their clinician's office who did the prescription, or treatment or other resource centers. And this is a critical piece because the majority of people in the community don't know how to recognize signs of dependence and addiction and don't know how to help. So this is what an initial email might look for Jane, who's just been prescribed a narcotic, and she picked her mom to be the person as her advocate. And the initial email to both of them contains information about opioids and the risks that she is undertaking them, and a link to her personalized dashboard, which we'll show you, and then a list of those resources. And then the alert comes when Jane refills her prescription, because refilling a prescription even one time elevates your risk of becoming a long-term user. And this email that goes to the patient and her advocate, this one is going to her mother, and it says, this is why you've received this alert, and here's the education about why you are at risk. It has a call to action so she can look for behavioral changes in her daughter and tells her what to do if she sees that, and additional resources. This is a mock-up of a dashboard, and you can see with the red and green, the reds are those things that have been alerted, and the green, for example, in the upper left-hand corner is she's under the dose of oxycodone, she's under the 90 MME, which would be if she got up to that 90 MME per day, it would provide an alert. The impact of this patient-centered access, awareness, and education has the potential for cost savings and saving lives throughout Virginia.
As for the technology, the good news is it's never been easier or, more importantly, cheaper to implement a solution using existing data infrastructure like the PMP to provide data to patients, not just healthcare providers and law enforcement. Over the last 2 days, this is our first attempt at the technical flowchart of different AWS resources that we use. So we have different ways of using the logic and connecting these things to create these individualized reports. And even though most of the problems that we ran into were with data sharing policies and then, of course, Amazon Web Services documentation, but even if we didn't, if we leave all that, if we just set up a nagging system to get people thinking about how dependency happens and providing those resources, just generalized information in the early stages before a problem develops, that's something that we can do tomorrow.